Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and obesity medicine doctor. Today, I will be discussing with you a case which highlights the importance of weight loss even when you are young. I am talking about a 30-year-old female who came to me today for evaluation of osteoarthritis. But she knew the cause of the osteoarthritis was obesity, and she wanted to lose weight so that she can reduce the joint pain and osteoarthritis that's happening because of not only the weight that she has, but also the metabolic inflammation that it's causing leading to joint deterioration. Welcome back to my channel, and if you're new here, I want to welcome you. As a rheumatologist, I talk about autoimmunity, osteoarthritis, and as an obesity medicine specialist, I also talk about how to improve the inflammation related to obesity and autoimmunity, and how can we reduce the inflammation to live a better life. In this case, I'm highlighting the importance of managing osteoarthritis of the knees in a young patient through weight loss treatment, through obesity treatment. We know that obesity can treat many diseases, including hypertension, hyperlipidemia, high cholesterol, reduces the risk of cardiovascular disease. But did you know that you can also treat osteoarthritis? And that studies are suggesting that actually we can reverse a lot of autoimmunity related problems through addressing obesity. So, as a rheumatologist, many of my patients who are coming to me for evaluation of osteoarthritis, I'm still treating them. But now I have the tools and the means to help them to lose weight and reverse the disease that's happening and maybe prevent future diseases in their joints. In this case, we're talking about a young female who suggested that obesity has been going on, mentioned that obesity has been going on for several years. She said that unfortunately the weight loss efforts have been unsuccessful. She's not been able to lose weight, and it has caused her to have steady decline in her physical activity. Not only that, she's unable to work out because of the knee pain, osteoarthritis of the knee. She has had x-rays done that already showed that she has patellofemoral arthritis, which is the arthritis between the patella and the femur bone, and also the medial compartment of the osteoarthritis of the joint, the femoral-tibial joint, which is the knee joint, we should say, in layman terms, that is also showing. And this osteoarthritis is often a painful, debilitating condition that leads to loss of cartilage between the bones, which leads to breakdown, causing friction, inflammation, pain, with difficulty with movement. So why weight loss is crucial for patients with osteoarthritis? Well, now we know that excessive weight, visceral fat leads to inflammation. And we know inflammation leads to joint pain. Inflammation leads to joint space loss. Because of the inflammation leads to cartilage breakdown. And this mechanism of just the pure mechanics of high weight on your knee leads to pound per pound increased loss of your cartilage, strength, integrity, leading to increased amount of joint damage. So the studies have shown that when we lose weight, we have reduced joint pressure. Every 10 pounds of weight loss can actually remove 40 pounds of pressure off your knees. So 1:4 ratio. If you lose 1 pound, 4 pounds less of your knee joint. Decreased inflammation is another benefit. Obesity is linked to chronic inflammation in the body, and by losing weight, you reduce their systemic inflammation, which also lead to decrease in joint pain and swelling. Slowing down the joint damage. As weight loss happens, you have less progression of the disease because you have cut down on the just the mechanics of the weight, but also reduce the inflammation, and there will be less wear and tear of the patients. If you start having knee pain, remember, if you do not reverse the weight problem or inflammation and don't become active, you're most likely to also develop osteoarthritis of the hip and the foot arthritis as well, because your weight is constantly causing that ongoing damage. You will when you will lose weight through treatment of obesity, you will also find improved mobility and the quality of life will improve. Shedding excess weight allows for greater mobility, which in turn leads to better and more options of physical activity and the energy to actually participate in physical activity, which is an important factor for overall joint health and your wellness. So, what are the strategies that we can take action for people who have osteoarthritis even at a younger age, and how can we reduce weight? Well, let's look at some practical strategies for helping patients who can reduce their weight and osteoarthritis at the same time. First of all, dietary adjustment. Focus on anti-inflammatory diets, foods like vegetables, fruits, lean proteins, fruits, and healthy fats, nuts, and spices like turmeric and ginger and garlic. They can help reduce inflammation, also reducing fructose, sugar, and processed foods. Number two, physical activity. Low impact exercises such as swimming, cycling, biking, or walking are excellent ways to stay active without worsening your knee pain. Even activities which are called non-exercise activity thermogenesis, meaning just staying active at home, standing while working, or doing using stairs, or being active even in your home while even watching TV. All of that leads to better and better outcomes of your joint health. This multifaceted approach, along with medication, can help reverse the disease, can actually slow the disease progression. So if you have osteoarthritis and you're dealing with this situation and you're thinking, how come I am having this constant joint pains? It's because of the weight, because of the obesity. Get rid of the excessive weight by choosing to live a healthier life. Every 1 pound lost will relieve 4 pounds off of your knees. And road to healthier knees come from taking action early on. Once the disease has progressed, once you have lost the joint, you should know that you will not be able to regenerate your cartilage. We do not have the medicine yet to regenerate the cartilage. Stem cell therapy is in infancy right now. We are working on understanding how stem cells can be used to regenerate the cartilage. There are some peptide therapies that sometimes I will talk to you about, which are not currently FDA approved. They're off-label, but we use them in our clinical practice to help patients reduce inflammation, and BPC, body protection compound, is one of them, which is being used for as a peptide therapy for reducing inflammation. And I'll talk to you more about it in another video in the future. But for now, I would like you to know that this channel is for information on autoimmunity, inflammation, and if you liked it, I want to thank you for watching this, and please share it with somebody that can also find it helpful, so that I see the interest from the public about this channel, so I can help to continue produce more useful videos. And stay active, eat well. Anti-inflammatory diet is the key to reduce inflammation in the body, and I'll see you in the next video.